The influenza vaccine group status rules have been updated for the 2016-2017 season based on the rules released by the CDC. However, the flu vaccine has not been developed to use the rules engine the same way as the other vaccine groups. It will not present the same age interval warnings. Because influenza is an annual vaccine, it will only take the recommended range set in the practice preferences. For example, it won't display the Do Now status until the patient reaches 6 months of age and older, and the time is within the flu season range. In previous versions, practices could set their default flu season, which is normally from September through March, on the Immunization tab of the Orders module Practice Preferences. Now the system includes a 4-week or 28-day window before the specified flu season to update the influenza status. This eliminates additional warnings of flu vaccines being due now if received within the 4-week window. For adult patients, it recommends 1 influenza vaccine per patient per practice-designated flu season. If a second flu shot is ordered, the age interval warning will alert. For pediatric patients, if it's the first time a patient gets a flu shot, it recommends 2 influenza vaccines within a flu season for one time. Once a patient completes the initial 2 vaccine doses in a single season, the recommendation changes to 1 dose for any subsequent years. If a provider orders a second flu vaccine in the same season, the system will warn about previous doses already documented. The minimum interval dose alert will display when the flu shot is ordered too soon for the second dose. If a third flu shot is ordered for pediatric patients younger than 9 years, the age interval warning will alert. Outside the current flu season, no warnings will be presented if other flu vaccines are given. Next, let's head to the Orders module to see how the flu rules work for adult and pediatric patients. We're currently viewing the Immunizations tab for an adult patient. The current encounter date is August 25, 2017. Because it's out of the flu season, which is September to March, the flu vaccine is not due now. But you can still order and administer a flu vaccine for the patient. I'll do that for you. Once the patient gets his flu shot, it displays in the immunization list. However, because it's out of the flu season, the status is blank. Once the flu season starts, the status is updated to current. If you attempt to order a second flu shot for him, you'll get the warning message. Next, let's take a look at the rules for pediatric patients. We're viewing the influenza immunization for a 7-year-old. He had 2 flu shots last year and 1 this year, so his flu vaccine status is current. If you attempt to order a second dose of flu for him this year, the warning displays. For the 7-month-old girl, she received her first flu shot a few days ago. She needs 2 shots in the current flu season, so the due date for her next flu shot displays. If you attempt to order the second shot sooner than the due date, you'll receive the minimum interval warning. For this 8-year-old girl, she received her 2 flu shots this year for the first time. If you attempt to order a third dose for her, you'll get the warning. And that's all about the flu rules updates.